So you change more and more, every time risking permanent disfigurement. This is one of the many scary realities of plastic surgery. My name is Flight Corporal Clements, and I'm going to be speaking today as the federal government of Canada for the resolution, should plastic surgery be banned? So firstly, to lay out a definition, we define plastic surgery as an elective procedure done solely for cosmetic purposes. This term is also interchangeable with cosmetic procedure. And then now, firstly, I'd like to model the resolution a little bit. Although we seek to ban unnecessary cosmetic surgeries, this resolution discludes reconstructive procedures after severe trauma and those covered under universal health insurance in Canada. So we're very proud to propose this resolution for the following reasons. I will be speaking about how cosmetic alterations set an unrealistic standard of beauty, how plastic surgery is a danger to public safety, and how it allows surgeons to capitalize on those with body image issues. Now, my partner will be speaking about how this resolution can save money for patients. He will be elaborating on risk and how the reallocation of medical research. So firstly, I'd like to get into my first point. I'll be speaking about cosmetic alterations and how they set an unrealistic standard of beauty. In this age where the media has so much sway over trends, beauty influencers have become very large icons, with many aspiring to be like them. Due to their status, oftentimes these influencers have the means to access a plethora of cosmetic alterations that may not be accessible to the general public. So for example, a rhinoplasty, or nose job, can cost anywhere from $5,000 to $10,000. This is according to ehealthcarecost.ca. And not everyone has the means to pay for such a procedure, and this may cause issues with self-esteem, bad body image, and among other issues. So as well, they do not accurately showcase the dangers associated with many of these procedures, which I'll be getting into next. So this leads me, in the end, cosmetic alterations are not accessible to everyone and can be very damaging to the body image of our citizens. Now, secondly, I want to speak about how this plastic surgery is a danger to public safety. Often, we hear horror stories of botched plastic surgeries, and these stories end up with those seeking beauty becoming disfigured after any surgical slip-up. In fact, in Canada, any doctor can call themselves a cosmetic surgeon. Additionally, the Royal College of Physicians and Surgeons of Canada doesn't recognize cosmetic surgery as a specialty designation. This is according to CBC In-Depth Health. So any surgeon can call themselves a cosmetic surgeon and perform these procedures without anything, without any qualifications other than just being a doctor. Now, some of the physical risks associated with plastic surgery include heavy scarring, permanent numbness and tingling, excessive bleeding, rejection of implants and injections, shifting of bodily fluids after liposuction. This can actually lead to death, permanent disfigurement. Private clinics are unregulated as well, leaving procedures and practices purely up to the doctor's discretion.
Source.
CBC Health In-Depth or healthline.com. These risks are very drastic, considering that the procedures involved are purely for the purpose of vanity. Allowing these types of activities to continue would be putting Canadians in harm's way. Now, on to my third point, how this allows surgeons to capitalize on those with body image issues. Everyone seeking plastic surgery is dissatisfied in some way with their appearance. This allows surgeons to swoop in and provide an insane solution to their dissatisfaction. This, of course, comes at a cost. Calculating the health risks is difficult, so surgeons may not discuss all of the risks with a patient. And again, due to the unregulated nature of the clinics. One could even go as far to say that cosmetic surgeons are breaking the Hippocratic Oath as they carry the risk to harm a patient without any real medical benefit. These doctors are providing an unnecessary and risky procedure and using this as a means to profit off of those that have issues with their body image. It would be immoral to allow this kind of behavior to continue. In the end, every day we are allowing these unnecessary and dangerous procedures to be conducted. They're putting innocent Canadians in harm's way, and we believe as the government, we have thoroughly proven that cosmetic surgeries are detrimental. We should be promoting positive body image and a better mindset throughout all generations to achieve sustainable and healthy lifestyles, rather than allowing these dangerous surgical alterations. This is why we as the federal government of Canada are so proud to propose this motion. Thank you.
I'd like to thank the Prime Minister for their remarks, and I call upon the member of the opposition to deliver their remarks and as well as refutation to the Prime Ministers. Hear, hear.
Thank you, Madam Speaker. Hello, judges, Madam Speaker, and fellow debaters. My name is L.A.C. Babcock, and today I will be talking about how with the passing of this resolution, we are jeopardizing the safety of those desperate and seeking an otherwise harmless procedure, how confidence can be improved by altering the attitude of the person having surgery, how there are health benefits to plastic surgery, and plastic surgeons would lose their jobs. My partner will be speaking about how the banning of cosmetic surgeries will strongly impact the medical sector, not only in hospitals, but the industry as well. By banning cosmetic surgeries, the government is encouraging unsafe activities, and plastic surgery will help people gain self-esteem. I would like to speak about my first point. With the passing of this resolution, we are jeopardizing the safety of those desperate and seeking an otherwise harmless procedure. When someone is denied this conditionally harmless procedure, they are far more inclined to illegally or go out of the country to receive these procedures, putting themselves in direct harm with non-certified professionals to receive treatment, or to leave the country to a healthcare system that is less developed than Canada's. This leads people to seek severely unsafe and illegal surgeries, severely impacting mental health. For example, seeking surgeries in illegal offshore locations with unsanitized equipment, you could be spreading HIV and hepatitis. For example, a woman named Tanya McDougall spent about $4,500 for a butt lift in the Dominican Republic that Toronto's clinic priced at $10,500 to $16,500 before tax. Banning plastic surgery will lead individuals seeking cosmetic surgery to further harm themselves using illegal and dangerous procedures, and possibly permanently impacting their lives. For my second point, I will be talking about how confidence can be improved by altering the attitude of a person having surgery. Some people need very little to jumpstart their image of themselves in a positive direction, and tweaking their physical appearance can be the boost that they need in order to see themselves differently. It is not just about the surgery in itself, though. There is a change in attitude that helps the transformation. When getting plastic surgery, individuals will be able to improve their self-esteem because it helps restore youthful appearance. With plastic surgery, an individual can eliminate things such as wrinkles on the face. As a result, they look younger. By looking younger, people won't feel so overwhelmed and uneasy about getting older. They'll be able to eliminate anything that can remind them of getting older. With a restored youthful appearance, a number of people will feel better about themselves and be reminded of a time in their life that was very fulfilling. Many people's self-confidence has been boosted by getting cosmetic plastic surgery. For my second last point, health benefits. There are health benefits to plastic surgery. Plastic surgery can improve breathing, vision, neck and back pain, self-esteem, and self-confidence, as I had stated before.
Source.
Plastic surgery can correct a deviated nasal septum and open up the nasal passages. Plastic surgery can improve your vision. Many patients start to notice their peripheral vision is blocked by baggy eyelids, or that their heavy eyelids create a fatigued feeling. Upper eyelid surgery, known as blepharoplasty, improves vision and reduces eye strain by removing the excess skin and tissue that weighs down on the upper eyelid. Plastic surgery can relieve neck, back, and shoulder pain. Many women, especially those with a small body frame, often have pain and discomfort related to added weight. In some individuals, this can be debilitating, making exercise and even daily living challenging. Pregnancy and weight changes can weaken the muscles of the midsection, and tummy tuck surgery tightens these abdominal muscles and reduces weight and sagging skin, recreating a strong, fit look. Tummy tuck surgery takes a lot of stress off your back, neck, and shoulders. For many patients, this relief can be dramatic, improving overall health and well-being. These are many reasons why and how cosmetic plastic surgery can actually improve your health. For my last point, all plastic surgeons would lose their jobs. With this action being taken, surgeons losing their jobs would then have no source of income. And all of the years they went to medical school studying how to be a doctor would go to waste, and the money they spent on medical school would also go to waste. They would then have to go back to school to get a new degree and pay for a new tuition. So if we ban plastic surgery, plastic surgeons and other medical experts would be in a bad position. In this speech, I talked about with the passing of this resolution, we are jeopardizing the safety of those desperate and seeking otherwise harmless procedure, how confidence can be improved by altering the attitude of a person having surgery, how there are health benefits to plastic surgery, and how plastic surgeons would lose their jobs. Thank you.
I'd like to thank the member of the opposition for their insightful remarks. I call upon the Minister of the Crown to come up on the fake podium and deliver their speech for 5 minutes.
Thank you, Madam Speaker. We, the government, think that plastic surgery should not be banned because, number one, it saves people money. Number two, there won't be any more unnecessary risks. And number three, scientists can study other medical sectors. So, number one, it saves people money because most people, some people are unhappy with how they look. And they could go into a hospital looking for a quick fix, and then some doctor could offer a quick, insane fix, and then they could see other things that they think are wrong with themselves. And then they'll keep doing plastic surgery, and then more, and then more, and then more, until they lose all of their money on plastic surgery. So if we ban plastic surgery, people won't be spending all their time and money on something fake that just makes them look better, just only for a little bit. Instead, they can spend it on something like therapy to make themselves feel better internally instead of something that's fake. And it has no medical value. It has almost no medical value. It's basically just used for looks and just self-esteem. And not only are we keeping people, and hold on. And second one is there's no unnecessary risk. People will be risking their lives to look better when they might even look up ending worse. And as the opposition said, that there is nothing harmless about the surgery. Of course there is. Things could go wrong. Basically any doctor can any doctor can say to someone that they are registered for cosmetic surgery, and they could believe them, and then they trust their lives and how they look to someone who has never done cosmetic surgery before, and they could come out looking worse than they started, and they could get even more depressed. And
can you state a situation in which that would happen?
And probably in other countries that do not have as good medical care as ours. As I was saying, and some equipment might not be sanitized, and they could pass on they could pass on different viruses, such as, you know what, scratch that. Every 1% of surgeries go wrong. So some surgeries can go wrong, and there's no way of fixing it without even more plastic surgery. And third of all, scientists can study other medical sections. If we ban plastic surgery, more talented people who are wasting their time on something that doesn't really help the public that much, they can be spending their time on improving they can improve other medical procedures like brain surgery, heart surgery. They can make it safer for the public, and they could make it faster, better, more successful. And over 8,000 plastic surgeons work in plastic surgery in the US alone. And these people can work in a more essential service. And imagine 8,000 people just in one service. If we put them to another service, it could get a lot better.
But how do we know they have training for these other services?
Well, they can go back to school for that.
But who would pay for their school tuition? Would the government pay, or would the surgeons have to use the money they don't have that much of anymore because what they did for a living was banned?
You want, just never mind that. So, and I actually wanted to bring up a point that the opposition said. When they were talking about plastic surgery improving health, there were no sources about that. So how are we supposed to know that that's true? And what else do I have?
It's true because there are operations that prove that it improves the health.
Okay, so this is why the government believes that plastic surgery should be banned, because more resources can be put into other medical sections. They can be developed and become better, and there will be no more unnecessary risks for people, and they won't be as depressed as they are, because they could get therapy or whatever, and scientists can study other medical sections.
Thank you, Minister of the Crown, for your remarks. I call upon the Leader of the Opposition to deliver their 7-minute speech, also serving as their rebuttal speech towards the last 2 minutes. I ask of the Leader of the Opposition to not bring up any new contentions towards the last 2 minutes of their speech. Here.
Thank you, Madam Speaker. Good evening, members of the House and fellow judges. The opposition strongly disagrees with the resolution brought up by the government that plastic surgery should be banned. So in my first 5 minutes, I'll be speaking about how the banning of cosmetic surgeries will strongly impact the medical sector, not only in hospitals, but in the industry as well. By banning cosmetic surgeries, the government is encouraging unsafe activity. And finally, plastic surgery will help people gain self-esteem. And then I'll move on to my rebuttals. So firstly, the banning of cosmetic surgeries will strongly impact the medical sector, not only in hospitals, but in the industry as well. Madam Speaker, the opposition strongly believes that the banning of cosmetic surgeries will strongly impact the medical sectors in hospitals and the industry. The banning of plastic surgeries will cause a shortage of money in hospitals. According to Global News, Canadians spend a total of $3 billion a year on plastic surgeries. Madam Speaker, the fact that the government is willing to ban plastic surgeries and lose $3 billion every year from this business is outrageous. It is not only the money that the government is willing to lose. There are many jobs that will be lost. All the industry will be halted. All cosmetic research to make the surgery safer will be halted. All jobs connecting to cosmetic surgeries, like the surgeons and even people who make live TV shows, will lose their jobs. Madam Speaker, the opposition does not believe that the government's actions are reasonable. We find it extremely unfair that the government will be taking innocent people's jobs. And for my second point, by banning cosmetic surgeries, the government is encouraging unsafe activity. Madam Speaker, the opposition strongly believes that the government's proposal is encouraging unsafe activity. This is because people who have an addiction to receiving these procedures will continue to get them illegally or in an unsafe environment outside the country. Canada, being a role model in healthcare, should be providing the outstanding service they always give. By doing these procedures elsewhere, possibly in an unsanitary environment or in a dangerous country, will cause harm to people. For example, if the needle they were using was unsanitary, they risk receiving diseases such as hepatitis B or HIV. Madam Speaker, we on behalf of the opposition believe that the government is promoting unsafe and illegal activities. We find this extremely unacceptable in our country. And for my final point, plastic surgery will help people gain self-esteem. Madam Speaker, we strongly believe that by banning plastic surgery, it would extremely impact people with low self-esteem. When we keep plastic surgery legal, it will allow people who wish to get this procedure, who are unsatisfied with their appearance. According to Time.com, they state that people who are satisfied with their appearance are more satisfied with their life as a whole. So why does the government not want people to live a happy life? Over a long period of time, people with low self-esteem may develop persistent feelings of sadness, depression, anxiety, and over time, they may develop extreme anger, which can lead to bullying. Madam Speaker, we do not think it is fair that the government is banning plastic surgery when it can help people live a long and happier life. Now moving on to my rebuttals. The Prime Minister stated that this procedure is risky and unnecessary, yet they did not state how risky. We're also never sure about anyone's situation. People are suffering from depression, anxiety, constant sadness, even constant anger, which would lead to bullying. Yet they want to ban this procedure. The Minister of the Crown also stated that this procedure saves people money because people are going to constantly spend money on this procedure. Yet as the opposition, we disagree with this, as people do not have to get plastic surgery multiple times. They can just repair the part of their body that they are unsatisfied with in their body. And the Minister of the Crown also said doctors can go in a different sector in the medical field. Yet he did not go into depth about this. All he stated was that they could go into a different sector in the medical field. Yet the government wants to remain clear of this, as he did not say how they were going to move from one sector of the medical field into the other. All he stated, and he didn't state if they would need to take more schooling or if they would just move into the sector, which if they were to just move into the sector, it wouldn't make any sense, as they wouldn't have any training and our healthcare standards will be lowered significantly. So in closing, the opposition strongly believes that the banning of cosmetic surgeries will strongly impact the medical sector, not only in hospitals, but the industry as well. By banning cosmetic surgeries, the government is encouraging unsafe activity. And finally, plastic surgery will help people gain their self-esteem. Thank you.
Thank you, Leader of the Opposition. For the last opposition remarks, I call upon the Prime Minister to come up and deliver their 2-minute refutation speech. I'd just like to remind you that no new contentions may be introduced. However, new evidence may be introduced. Yeah, that's it. It's the last speech of the debate. Hear, hear.
Right. Thank you, Madam Speaker. We as the government have the well-being of our citizens primarily in our heart. Plastic surgery is affecting many, many Canadians, especially with botched plastic surgeries. Plastic surgery is creating unrealistic beauty standards. It is maiming and scarring our citizens from failed procedures, and citizens are being affected by predatory surgeons. By banning plastic surgery, we are keeping our citizens' wellness and mental health at heart. Additionally, we are saving our citizens money. We are saving them from risk, and we are able to reallocate these to more things other than just primarily vanity. The opposition mentions almost everything as sunshines and rainbows, that plastic surgeons can do no harm. This is quite false, as we've already mentioned many times where people have died, where people have been injured, maimed, or scarred for life by these plastic surgeons who care only about their profits. We are banning a predatory practice. In the end, by banning plastic surgery, we are keeping our citizens' well wishes at heart, and we are keeping our citizens safe. Thank you. Way too short.
Sorry, I was in the middle of a olive.
All right.
Okay.
Nice.
All right. So, thank you, Prime Minister, for the last remarks of this debate. I now call this debate closed, and I ask of you to stay in the Zoom call for a couple minutes